much. And those of you that are contemplating traveling to Arizona in the coming months, I welcome you and let you know that the temperature is now subsiding back below 100 degrees. So we're looking forward to seeing you in this coming winter. Thank you, Dick, for your kind introduction. Dick and I first met back in 1996 when we were both part of Bill Graham campaign for president. Still the smartest man I know on economy in the United States of America, and a dear friend. My daughter Megan is here, who recently graduated from that institution of hard right-wing conservatism, Columbia University. I think I got her out of there just in time. And Greg Gansky, Dr. Greg Gansky, who I had the honor of serving with in the Congress of the United States, and a great physician and one who understands the healthcare challenges as well as anyone in America today. I thank you, Greg, for being here. And of course, Governor Ray, thank you for everything that you have done for the state of Iowa for so many years, and a pillar of integrity and honesty and service to country and state. And we're always honored to be in your presence. Thank you, Governor. By the way, I don't know if you ever heard the story of the two inmates in the state prison in the chow line, and one of them turned to the other one and said, "The food was a lot better in here when you were governor." Some states you can't tell that joke. I want to thank you for the opportunity to talk today about the American healthcare system. And following, I'd be glad to respond to your questions or comments about this or any other issue that you'd like to discuss. There's many compelling issues of the day. But as you know, you don't have to be a candidate for president to discover that worries over the availability and cost of healthcare trouble the waking hours and disturb the sleep of more Americans than any other single domestic issue. Indeed, outside of the preeminent challenge of our time, the threat of Islamic extremists, no issue comes up more frequently in large and small public discussions, in polls, debates, and media reports. So it's surely appropriate that the subject figures prominently in this presidential election. And in our eagerness to appear responsive to this acute public concern, every candidate will feel compelled to offer his or her, quote, solution to the problem. But will these solutions actually improve our healthcare system? Or will they merely serve as the candidate's opening ante in what looks like to become a bidding war? In our haste will we promise more than we can deliver? Will we misdiagnose the problem and devise a cure that will kill the patient? Will we even ask ourselves that first, most important of questions: what exactly is the problem with the American healthcare system? The problem, my friends, is not that Americans don't have fine doctors, medical technology, and treatments. The state of our medical science is the envy of the world. The problem is not that most Americans lack adequate health insurance. The vast majority of Americans have private insurance, and our government spends billions each year to provide even more. The biggest problem with American healthcare system is that it costs too much. And the way inflationary pressures are actually built into it. Businesses and families pay more and more every year to get what they often consider to be inadequate or poor health care. And those who want to buy insurance are often unable to because of the high cost. What more compelling evidence of the problem do we need than to note that General Motors now spends more for health care of its employees and retirees than for the material required to manufacture its products, steel. The price of every General Motors car includes over $1,500 for healthcare costs compared to Toyota, whose total cost for healthcare per car is about $200. How can you be competitive in a situation like that. The growth of costs affects everyone. Government overspending, business costs, and family budget. It hurts those who have insurance by making it more expensive to keep. And it hurts those who don't have insurance by making it even harder to attain. My friends, we are approaching a perfect storm of problems that, if not addressed by the next president, will cause our healthcare system to implode. Here's what we know. First, we currently spend $2.2 trillion, 16 cents of every dollar we spend, on healthcare. By 2015, just 7 years from now, that number will nearly double to $4 trillion. Second, by 2019, Medicare will be broke. We are currently spending more on Medicare than we're collecting in payroll taxes and cashing in the few IOUs left in the trust fund. In the meantime, more and more of our retiree Social Security checks also go to pay for Medicare, leaving our seniors with less money for their everyday expenses. Third, by 2017, more money will be going out of Social Security than is coming in. The next president, my friends, must act to avert the impending storm. For all the grandiose promises made in this campaign, has any candidate spoken honestly to the American people about the government's role and failings and about individual responsibilities? Has any candidate told the truth about the future of Medicare? Its costs are growing astronomically, faster than its financing, and leaving its structural flaws unaddressed will hasten its bankruptcy. Has any candidate warned that we have a personal responsibility to take better care of ourselves and our children? Yet that is the only way to prevent many chronic diseases. Has any candidate insisted that genuine and effective health care reform requires accountability from everyone? Drug companies, insurance companies, doctors, hospitals, the government, and patients. Yet that is the truth upon which any so-called solution must be based. Democratic presidential candidates are not telling you these truths. They offer their usual default position. If the government would only pay for insurance, everything would be fine. They promise universal coverage, whatever its costs, and the massive tax increases, mandates, and government regulation that it imposes. I offer to you today, my friends, a genuinely conservative vision for health care reform which preserves the most essential value of American lives, freedom. Conservatives believe in the pursuit of personal, political, and economic freedom for everyone. We believe that free people may voluntarily unite, but cannot be compelled to do so, and that the limited government that results best protects our individual freedom. In healthcare, we believe in enhancing the freedom of individuals to receive necessary and desired care. We do not believe in coercion and the use of state power to mandate care, coverage, or costs. I believe Americans want to be part of a system that offers high-quality care, that respects their individual dignity, and is available at reasonable cost. Unfortunately, the American healthcare system, as it is currently structured, fails its tests. It is too expensive. My friends, it is too expensive. It insults our common sense and dignity with excessive paperwork, disconnected visits with too many specialists, and by elaborately hiding from us any clear idea of what we're getting for our money. We must reform the healthcare system to make it responsive to the needs of American families, not the government, not the insurance companies, not tort lawyers, not even the doctors and hospitals.